Hello, I'm Sarah Morris. Welcome to the first edition of The Physician Entrepreneur, powered by SoPE. Our goal is to help you take your healthcare ideas or inventions and commercialize them. We began with one doctor who is helping patients make better medical decisions using their cell phones. Let's say I've got a terrible pain in my right side. Could this be an appendicitis? There's an app for that, and it was created by a physician who realized there was a need to help patients before they ever see a healthcare provider.
It's the hardest thing you'll ever do, but the most fun you'll ever have.
Right.
Dr. Wayne Gira is the Chief Medical Officer and co-founder of iTriage,
What are you guys working on?
a technology company that developed a downloadable app to help people make decisions about their medical needs.
I would see probably 1 or 2 patients coming from an urgent care clinic because they self-directed themselves to a lower level of care with appendicitis, with bowel obstructions, with a stroke. So things that they should have come straight to the ER for us.
The goal is to change the way people seek medical treatment.
I can look up doctors directly. I can look at facilities all across the country. I can look up medical conditions.
Even assisting them with understanding medications.
And I can see, side effects of that medication, usage instructions. What do I do if I missed a dose?
The app uses an avatar as a guide.
You can look at a different gender, obviously, male or female. You can rotate.
Simply click on the part of the body where you're having an issue, and from there, you can get answers on just about everything.
These are the common symptoms of hand pain.
All of this information is available at your fingertips by downloading the app onto your Android or iPhone.
Giving people information that they can trust, to put it in their hands to make the next best decision.
It's something Gira is passionate about because he worked for over 20 years as an emergency medicine physician, and connecting with patients seemed easy using a smartphone.
The business model is it's free for users, and then providers for an annual fee will provide more content for the users around them.
But they had to reach out for help when it came to building the actual app.
We went out and started interviewing different technology companies because we weren't technologists by nature. Literally, we would draw the phone and draw on the piece of paper, outline the phone, and just put in where we wanted the buttons. Take a picture and email it to a technologist.
Just like any startup business, you need to have funding. Gira suggests finding investors.
Tapping into your social network, your business associates, people that you know. We had a strategic investor, a large ER group that was running about 50 hospitals.
But doing all of this wasn't easy.
Transitioning part can be tough because as a physician, you're making a certain salary. It's hard in a startup world to say, I'm going to pay myself that salary and do this venture. You typically have one foot in this entrepreneurial startup world, and you still have a foot in the clinical world supplementing your income.
Currently, there are over 7 million downloads of the iTriage app.
So it really evolved a ton.
Gira now depends on his team of over 80 employees.
All our content is written by in-house clinical team of physicians and then reviewed by the Harvard School of Medicine.
Final testing.
And every day, they're making improvements.
What we'll be able to do is have a HIPAA-secure communication channel through iTriage.
As iTriage continues to grow with other health groups latching onto the app,
When do you think that'll come out?
Gira has no regrets making the transition from physician to entrepreneur.
I think there's just so many areas that a doctor can improve the delivery of healthcare.
And Dr. Gira credits his success to the people who helped him along the way, whether it was creating the actual app or giving him the money needed to start up a small business. He says he and his business partner couldn't have done this alone. Which is why the Society of Physician Entrepreneurs, or SoPE, works to bring medical professionals together to empower them and provide them with the tools needed to pursue an entrepreneurial path. The group hosts dozens of events throughout the year, including the Denver Digital Health Summit. A new day brings new opportunities.
Good morning.
For these medical professionals at the Denver Digital Health Summit in Lone Tree, Colorado.
Good morning. How are you?
I'm well.
And while many are exploring the opportunities in digital health,
digital health is the key. It's like oxygen in that realm in terms of being vital and essential to changing these companies continuously in a way that's going to keep them on the edge and competitive and moving towards less expensive healthcare and better health for people.
Others hope to connect with experienced healthcare technologists, educators, investors, and entrepreneurs.
A lot of physicians are looking for other opportunities to make a decent living, but be able to contribute to society as a physician in some form or fashion.
Bringing medical professionals together is also the mission for the Society of Physician Entrepreneurs, or SoPE, which promoted the event.
We provide education and networking events on a monthly basis.
Arlen Myers, president and CEO of SoPE, believes there are more opportunities now for medical professionals than just being a clinical physician.
Most doctors have lots of ideas. They see things every day at the bedside, in the clinic, in the operating room, in an outpatient clinic, but they just don't know what to do with them.
Myers, a practicing surgeon, decided he wanted to capitalize on his ideas and got his MBA. But making the transition into the business world wasn't easy, which is why he helped create an organization that would assist medical professionals along their journey.
In order to be a successful entrepreneur, let alone physician entrepreneur, in my mind it takes a couple things. It takes education. You have to have some basic understanding of business and how it works from an educational perspective. You have to have networks. You have to connect to people, and those are usually service providers and investors who can help you move your idea forward.
I think Arlen's opportunities through SoPE have been tremendous because they bring people together.
For Dr. Irene Frederick, she wanted to use her ideas she learned from working as an OBGYN for 25 years and teach grad students about healthcare leadership.
I just jumped in feet first, and I've been very fortunate. It's been a very, very positive transition.
So much so that Frederick now works to help others looking for new career opportunities.
Well, I think any time a physician broadens their horizons and becomes more a part of the real world and not isolated in clinical medicine, that is a positive thing for their clinical practice as well.
It's all about providing opportunities for medical professionals wanting more.
So there's lots of ways that you can help patients being a physician entrepreneur, not just taking care of patients.
For more information on SoPE events or to join, go to soapnet.org. For the Physician Entrepreneur, I'm Sarah Morris. We wish you success on your journey to becoming an entrepreneur.